Mark Hyman is a family physician and a best-selling author. He has worked for over 20 years to address the roots of chronic illnesses that now affect 1 in every 2 Americans. Mark is chairman of the Institute for Functional Medicine, a whole systems approach that works to tackle our chronic disease epidemic by treating the underlying causes of illness rather than simply managing symptoms. As a volunteer for Paul Farmer's Partners in Health, Mark was the first doctor team on the ground after the 2010 earthquake in Haiti. He soon realized that Haiti's community-based solutions for tuberculosis and AIDS were exactly what was needed to respond to other chronic illnesses found here in America and elsewhere. Inspired by his experiences with Dr. Farmer, Mark began to work to bring community-based change to the first world epidemics of obesity and diabetes. Mark has written a number of books. His most recent project is The Blood Sugar Solution, a book and companion PBS special that will be released next March. Please welcome Dr. Mark Hyman.
Morning, everybody. So just before Christmas in 2009, I was given a book by a patient called Mountains Beyond Mountains. This patient was recommended to me by a shaman, so I figured I probably should read the book. I read the book over Christmas on top of Machu Picchu. And I came back and I wrote my friend Hillary Clinton a letter, and I said, in an email, I said, Hillary, what Paul's doing for infectious disease around the world is an extraordinary model that we could apply to chronic diseases. A couple of days later, the earthquake happened. And like most of you, I watched the news with horror. But the next morning, I woke up, and my wife and I looked at each other, and we said, we have to go. We didn't know how we were going to get there. We had no way of finding our way in. There were no flights. The airport was closed. I thought of calling Paul Farmer, but I didn't really know him. So I basically just put it out there to the universe, and an hour later, I got an email from one of my patients who's a billionaire who has a Gulfstream 5, and he said, you want to go to Haiti? So I said, yeah. He said, okay, put a team together, and made a few phone calls, reached Paul Farmer. He joined us. We got down to Haiti. It was clearly a disaster. The whole city had been leveled. Port-au-Prince was shattered. The spirit of the Haitians wasn't, but the city was shattered. The palace, the main building where people led the government, was completely destroyed. And we got there at night, and yet, there had been people laying there for 3 days without any care. No water, no food, no medical care. Everybody had abandoned all the hospital buildings, laying out in the courtyard with open wounds, festering for 3 days in the heat. The stench was overwhelming. And yet we just started working right away. My wife is an orthopedic surgeon. We started triaging patients, examining them. We set up an OR overnight. We found an empty building that hadn't fallen down. We got things going. Woke up in the morning and saw devastation. The nurses' school was completely collapsed with 150 nurses inside. You could smell it every time you walked by. There were people out in the courtyard trying to figure out what to do. And we slowly put together, over the course of 2 days, 5 operating rooms, built teams of providers to take care of them. But it was very traumatizing. And I think for most of you, it was traumatizing just watching it and being there. We were just running on adrenaline and working. We went and built these ORs. My wife is an orthopedic surgeon, so we did the first amputations with hacksaws. We had no running water, we had no electricity, we had no sterilization equipment. We had even no gowns. We had gloves. We had some headlamps that I got from the store, camping store, before we left. And we were exhausted. I mean, we worked hard. We exhausted. We did something useful. We felt, like every day that we'd done what we could, but there was an endless amount to do. And it was sad, and it was a traumatic experience. But I learned something in Haiti that was unexpected. I called Paul Farmer the night before we left, and we had a couple extra spots on the plane. I said, Paul, you want to come? And he said, sure. So he met us at the plane in the morning. He came down with us, and we became friends, and I began to understand what he did in Haiti. I began to understand that he saw a problem 30 years ago, which was intractable TB and AIDS in the poorest areas of Haiti. This is Cange. This is where people have no running water, no electricity, 80% have no sanitation. On a good day, they make less than $1 a day. On a good day, they don't have enough to eat. And this was not a good day in Haiti when we got there. And he basically went down there 30 years ago and realized that what was going on was not a medical problem. It was a social problem. That AIDS was curable. That TB is curable in the sense that these diseases can either be cured or put in remission. And it wasn't because we didn't know what schedule of medications to take. It was because it was something he called structural violence, the social, economic, and political conditions that drive disease and that drove TB and AIDS in these poor countries. And people gave up on these countries. This is the poorest country in the Western Hemisphere. And he went to the poorest place in the poorest country in the Western Hemisphere, and he set up a medical clinic, and he began to train community health workers to go out in the community and work with people, to accompany them, to build the communities back up better, to get people healthy together. He understood that this was a social disease and it needed a social cure. And began to realize that this was exactly what was going on in America and developed countries, and increasingly in developing countries, that obesity and chronic disease is a social disease. Now, what Paul did was he didn't look at the problem and say, well, how do we prescribe better medications? How do we invent a new drug or surgery or some intervention that's going to cure these people? What he said was, we need something quite different. When Henry Ford was asked, said that if he'd asked his customers what they wanted, they would have said a faster horse, right? Not cars. But we need to think cars, not horses, and that's exactly what Paul did. He created this clinic. He built this up. He has a beautiful philosophy. He's a really compassionate man. He said, the happiest man is the one who makes others happy. And that's what he did in Haiti, and that's what he's done around the world in Rwanda and Russia and many other places. This is Cange's facility up in Haiti, and he realized that we can get healthy together, that we can only really get healthy together, that we need to connect with each other in community to support each other to create a full and rich and healthy life. And that doing it alone, as we try in this healthcare system, just doesn't make sense, and it's not working. Now, on the first week after the earthquake, I was sitting down, we finally caught our breath, the dust settled, and Dr. Leseg, this gentleman with me, said to me, I said, well, what was the most common admitting diagnosis to the hospital here? This is the main public hospital in Haiti. I said, what was the most common admitting diagnosis before the earthquake? And I thought he was going to say malaria, TB, AIDS. He said heart disease, diabetes, hypertension, right? This is the poorest country in the Western Hemisphere, one of the poorest countries in the world, and the most common diseases there are chronic, lifestyle-driven diseases. Now, the gentleman in the middle, he's the guy who brought us some equipment, some generators and some medical equipment. You might recognize him. We're facing a tsunami of chronic disease, something that we have never experienced before in all of human history. Our life expectancy is going down. We're experiencing something called an epidemic of NCDs, which means non-communicable diseases. And what's striking is that across the globe, these are responsible for 73% of all deaths in developing countries, 90% of deaths in America. And these globally will cost our economy $47 trillion over the next 20 years. 3 times our entire national debt, and yet these are completely preventable and curable and reversible with the right interventions of the right health information based on systems, which we'll talk about, and based on the social cure. These risk factors are risk factors for death, not just in America. High blood pressure, smoking, high cholesterol, obesity, high blood sugar, and high cholesterol. These are the 6 most common risk factors for death across the globe. There are 50 million people who will be dying from chronic disease within 10 years per year, compared to 20 million from infectious disease like TB, AIDS, and malaria. This is globally, so this is not just an American problem. Now, our governments are not very good at helping us deal with this. The government food stamp program spends $4 billion a year paying for soda for Americans. 10 billion servings a year of soda for poor Americans is paid for by our government with our tax dollars. That's almost 30 million servings a day. And when the New York State Commissioner of Health requested a pilot program to restrict the use of food stamps for buying sodas, it was declined by the United States Department of Agriculture because who knows why, but it was all kinds of crazy reasons, like it's discriminatory, et cetera, et cetera. Maybe it's discriminatory against big food. Now, we have an enormous problem in America. 1 in 2 Americans is either pre-diabetic or diabetic. I'm going to say it again. 1 in 2 Americans is either pre-diabetic or diabetic. This is what's happening now in America, and this is a completely preventable and reversible disease with lifestyle. We now can reverse diabetes simply through changes in lifestyle. Now, childhood obesity is also a crazy problem. We're seeing a 35% increase in strokes in 5 to 13-year-old kids. I never saw a stroke in a 5-year-old kid when I was in medical school 30 years ago. There's been a 51% increase in stroke in 14 to 34-year-olds. This is a national crisis. And we're not going to bypass it with surgery or with gastric bypass. We're not going to deal with it by medication. This is from the New England Journal of Medicine that said in patients who have advanced diabetes, using drugs and insulin to lower blood sugar was not a good idea because it killed people. Now, this is completely paradoxical and contrary to what we think, but the reason this is so is because it's just treating the symptoms. High blood sugar is a symptom of something else, and if you take drugs to shut down that symptom, there'll be another problem coming up, and that's heart attacks. Drugs, this is the most common drug used to treat diabetes globally, was responsible for 47,000 excess cardiac deaths since 1999. And the main reason people die from diabetes is heart disease. So why take this drug? Mark Twain said, it ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. Right? R.D. Laing said that scientists can't see the way they see with their way of seeing. We're locked in our paradigm, and we can't get out of it. The food industry and industrial food is driving this epidemic. Big food, big pharma, and big farming are driving obesity and diabetes and chronic disease across the globe. It's pretty frightening. Now, the prevention strategy is key, not prescriptions. It's not going to be found through prescriptions. Albert Einstein said the problems that exist today in the world cannot be solved by the same level of thinking that created them. We need to rethink medicine. We need to rethink disease. We need to realize that the fundamental ways that we treat chronic illness today in America are based on outdated 19th and 20th century ideas about acute illness and the germ theory of disease, and they no longer apply to treating an ecological and social problem, and a problem in biological and social networks. Nigel Crisp, who is the head of the National Health Service in England, the biggest healthcare organization in the world, said we need to turn the world upside down. We need to make it patient-centered, not healthcare and doctor-centered. We need to empower patients to take back their own health. We need to learn from the third world what we can about how to treat disease, which is often all they have is each other. All they have are community-based solutions. And we have not tapped into those. And chronic disease results from an emergent pattern of environmental influences on our genes that create a disturbed metabolism, leading to the signs and symptoms we call illness or disease. This is a pattern that we can recognize and we can deal with, but we have to sort of go to the root of the problem. We can't simply keep turning off the symptoms with medications or trying to bypass them with surgery. This is a big take-home here. Food is information. It's essentially data that talks to your DNA. And it turns on or off messages of health or disease that in every moment control your health. This is not something that happens in the next generation. This is every bite you take, every thought you have, every move you make. You literally, it sounds like a Sting song, right? Literally turns on or off messages of health or disease, and in a way that is extraordinarily powerful and very, very quick in action. It works better, faster, and cheaper than any medication. We can take people who have diabetes and in 1 week get them off their medication and reverse their diabetes and get them to heal in terms of their pancreas and liver in 1 week. This has been shown in data from, yeah, thank you. It's not my research, but this is data that's been coming out of England and other places, and we've been doing it in our practice, and we're seeing it. We have people who have been on insulin for 20 years who now are off insulin, who have never been able to lose weight. It's simply applying the right information in the right support. And food is information. It talks to your genes. And these two mice are identical, but the only difference was in the mother. In the fat mice, they had the traditional mouse diet. In the thin mouse, they had a few extra nutrients that turned on certain genes that turned off and silenced the fat gene and the diabetes gene. I had these patients come in my office all the time with these kinds of problems. This lady came in, she was tired, depressed, overweight, or had arthritis, she was losing her memory, she was fatigued, and I put her on a simple lifestyle and nutritional support program, and this is her 6 weeks later. Now, of course, her husband went on the 6-month plan, and you can see this is very powerful medicine, and it can sometimes become out of control. Dean Ornish showed in prostate cancer you could reverse prostate cancer simply through a whole foods plant-based diet, that you could do this in ways that regulated genes. So in simply 3 months of eating real food, he was able to beneficially affect over 500 genes, turn off the bad genes that were causing cancer, turn on the good genes that were the cancer-curing genes. This is powerful stuff. So understanding how our genes and environment interact to create disease is very key, and understanding how powerful lifestyle is. It's not just prevention, it's actually better treatment. The answer to our healthcare problems are not going to be found at the tip of a needle. They're not going to be found at the bottom of a pill bottle. They're going to be found at the end of your fork. You know, surgeons like to say they heal with steel. I like to say we heal with meals. Food is medicine. It's not like medicine, it is medicine. It's the most powerful drug we know of, and you should get your medicine at the pharmacy here. Your grocery store should be your pharmacy. I just wrote an article that was published this week on Huffington Post called Eat Your Medicine. Food is Pharmacology. I encourage you to read it. So we have to stop mopping up the floor with symptom control treatments. We need to turn off the faucet. And that's what I did with George, who was 300 pounds, came to see me with a whole list of diseases. That's why I call myself a holistic doctor. And he had 9 medications. He had diabetes, angina, heart failure, reflux, hypertension. He had high cholesterol, erectile dysfunction, you name it, he had it. And he was on 9 medications by 9 different doctors, and he still was fat and sick, right? Now, most doctors say, oh, well, I'll just treat one problem. This is super specialization, right? I'm just going to deal with one problem, or one problem today, come back another time. But you know what? Your body is one system. It's an ecosystem, and it's part of the larger ecosystem. And until we understand that, we're not going to be able to solve this problem of chronic disease. This is a fish farm, not a bunch of flamingos. This is a fish farm where the treatment for a debilitated and sick estuary was hiring an ecologist who brought this land back to life. And as a byproduct of creating a healthy ecosystem, they produce 2,000 tons of fish every year. This is Veta La Palma in Spain. It's now the biggest bird sanctuary in Spain. It's extraordinary. Now, half of the shrimp and 20% of the fish get eaten by the birds, but that's okay. They don't put any energy into the system. It's actually a phytoplankton and algae farm. It's like grass-fed fish, right? They just take care of the ecosystem, and the fish is a byproduct. In the same way, when you create a healthy ecosystem in the body, disease goes away as a side effect. You don't have to treat it. So we treat the system, not the symptom. We treat the system, not the symptom. This is what functional medicine is, or biological medicine. You might have heard of Dr. Rao. And this is George before, and this is him after. He lost 140 pounds. We bypassed the bypass. All his diseases went away. All his medications were gone. And he became 20 years younger biologically. Extraordinary. And we did it by addressing the biological social networks that drive disease and creating a disruptive model for healthcare. Now, we have to understand that everything is connected, right? This conference is called Connecting for Change, and it is never been more true in our understanding of biology, that everything is connected, that all our metabolic pathways are connected, that all these diseases are connected, that our social networks determine health. You're more likely to be overweight if your friend's friend is overweight than if your mother or father or brother and sister is overweight. Our social relationships and our community drives a lot of our health determination behavior. So we have to look for these patterns. We have to understand this future of medicine, which is understanding these biological and social networks. It's called P4 medicine, or functional medicine, which is preventive, it's personalized, it's predictive, and it's participatory, meaning we have to engage you and the community in this process. It's not that you go to the doctor, you get a pill, I'll see you in 6 months. It's a participatory process, and it's based on understanding how each person is unique and individual, and yet understanding also how we can create a roadmap for you to create health based on this model. So it creates a rethinking process. We have to reframe and rethink disease, rethink health, and rethink medicine. It has to be about creating ecosystems and healthy ecosystems. I'm the chairman of the Institute for Functional Medicine. We train physicians in over 40 countries. We've worked with over 30 medical schools, and we're implementing this model in education to train doctors to think differently about health. We're trying to think cars, not horses here. Now back to Paul Farmer. I came back from Haiti, and it really moved me, and I really didn't know what to do with it. And I had this overwhelming feeling that health was a social problem, that this was not only a medical issue, but there was a social problem, and it was a human right, as Paul talks about, and that the real issue was structural violence, that the social, economic, and political conditions that exist today in America and around the world are driving obesity and disease. It's the big farming, big food, and big pharma that are driving an industry that's 30% of our economy that profits from people being sick and fat. This is a problem. So I try to think of innovative or disruptive or disintermediating solutions that can actually create a solution. So the same guy that took me to Haiti on his plane introduced me to this guy, Rick Warren. Now, he's a polarizing figure. He's an evangelical Christian. I don't agree with all his beliefs and views. However, he's an extraordinary man. And he came to see me because he got religion about health. And I said to him over dinner, after our appointment, I said, Rick, tell me about what you do. He said, well, I have a church with 30,000 members. And I said, wow. He said, yeah, and they meet every week in small groups. And the light bulb went on in my head, and I said, wow. Here's an opportunity to create a social experiment, to see what we can do to create a healthy living curriculum delivered through these small groups. They already had the small groups, and Rick was a lightning rod and could catalyze people and engage people. So we created this idea, something called the Daniel Plan, after Daniel from the Bible. And we brought it to the church in a big rally. And we introduced this idea of getting healthy together, that we're better together. And we implemented a solution for our social disease of chronic illness. And what was happening is that these people in Saddleback in Orange County were sick. I didn't realize it, but the average weight was 210 pounds for men, 170 for women. We had 14,000 people sign up overnight to become part of this program. And we did a survey after the first 6 weeks, and the average weight loss was 7.8%, which would reduce diabetes and chronic diseases by over 60% and account for hundreds of billions of dollars in savings if extrapolated to the rest of the country. They lost the equivalent of a house in 6 weeks, equivalent of a semi-tractor trailer full of Coca-Cola in a week, or a Suburban in a day, every day. This is enormous. We just did a survey after after almost a year. I'm going back there tomorrow. That's why I had to switch my talk from yesterday to today. And to deal with this sort of next stage of the rally, and I'll tell you what we found. So the solution isn't genomics, it isn't proteomics, it isn't better science, it isn't understanding genes. I was on a panel a few weeks ago with Craig Venter, the guy who decoded the human genome, and I said to him, Craig, so do you think that the Human Genome Project has fulfilled its promise? And he said, well, it depends what that means. And I said, well, you know, has it delivered improvements in healthcare? Well, we delivered the promise of decoding the human genome, but we don't know really much about what it does after that. And there are some things that have come out of it that are useful, but on the whole, you know, it's overpromised and underdelivered, because the problem isn't understanding genes better. The problem is understanding the determinants of health. And the determinants of health are really things that are driven by what we eat, how we move, what we think, how we feel, our relationships, our connections, environmental toxins, all the things that we actually can have impact on collectively. So we created this concept, this Daniel Plan concept, and we delivered this curriculum, myself, Mehmet Oz, Daniel Amen, and Rick, and we've done this through the community over the whole year. And every week there's new education, new curriculum. They do it in their small groups. There's videos, there's recipes, there's coaching. I mean, I even take people through a video called Surviving the American Supermarket, How to Hunt and Gather in a Food Desert. And, you know, we try to find the stuff that you can actually eat, the real food. And it's there, but it's hiding. I encourage you to go watch it. Pastor Steve, this is Pastor Steve. He was born again. And he lost 35 pounds in the first few weeks, 4 inches off his waist. His triglycerides dropped by over 300 points. His cholesterol dropped by 50 points. His good cholesterol went up over 20 points. His blood sugar went to normal, and he got off all his blood pressure, diabetes, and medications. This is fast-acting medicine, and it's powerful. He went from eating ribs for breakfast, and you can see here he is having a rib for breakfast. That's a rib there. To really changing his life. And it's pretty extraordinary. Now, we just got some data back in the survey. This is not, you know, randomized survey, controlled data, but essentially it looks at some of the improvements that we've seen over the last year in this group. We've seen significant weight loss, more energy. We've seen better sleep. We've seen improvement in mood, better blood work, blood pressure, and reduction in medications. If these kinds of changes, based on this social experiment, were scaled across America, we would see a dramatic reduction in our healthcare costs and improvement in health overall. And people said they were generally able to do the program. It wasn't that hard because it was easier to do together. In fact, it was quite easy when they found it did together. What was striking to me was this data that just came out. The average weight loss was about 9 pounds if people did it on their own. But when they did it together in their group, they lost almost twice as much weight. This is an extraordinary result. And it tells us that we're better together. Now, this study came out yesterday in the New England Journal of Medicine. It talked about how neighborhoods impact health. What they did, and this is an extraordinary study because it wasn't a study with any medical intervention. There was no changes in diet, no exercise regimens, no coaching, no health support in any way. All they did was give people vouchers who were poor to move from a high poverty to a lower poverty neighborhood. That's it. And they followed them for many, many years. And they found that there was this extraordinary reduction in diabetes, obesity, and chronic disease, simply by changing the social environment. So the social networks, our community, is really what the main determinant of health is. And understanding that we need to take back our health by creating a decentralized model of healthcare and a community-based model of healthcare, to create a model that empowers people to take back their health. Now, Rick Warren shows us slides of Rwanda, where he spent a lot of time. And Kagame did some extraordinary things in the rebuilding of Rwanda. But what Rick showed is that there's basically 3 hospitals in Rwanda. That's it. And they're about 2 days' walk from the average Rwandan. Now, there's about 24 health centers, about 1 day's walk from the average Rwandan. And there's about 728 churches, about 5 minutes' walk from the average Rwandan. Now, where do you want to get your health care, right? Maybe you don't want to get it at church, but the concept is that the community-based solutions are where it's at. People change behavior together. You're more likely to die if you're not in a group than if you are in a group. People who are part of any group, whether it's a knitting group or a bowling group or any kind of group, live longer. So What I've realized is that as a society, as a community, we need to take back our health. You know, everybody's on Wall Street now. Everybody's crying out about the economy and about the disparities that are going on around the world, in economic disparities. And people are getting mad. And I think that we need to get mad about our health and about healthcare. This is something we're taking lying down. So I believe we need to start a movement called Take Back Our Health. To take back our health from the places that have been taken from us, from our homes, from our schools, from our workplaces, from our democracy, from our healthcare system. Our health has been taken from us in every sector of life, and we just sit there. So in my next book, The Blood Sugar Solution, I talk about not only a personal plan for reversing obesity and diabetes, not only a plan for people learning how to do this together and get healthy together, but also a social plan, a plan for us to create a social movement to take back our health. And I've put up my Take Back Our Health sort of strategy and some of the ideas that are just the beginning of some of the things we can do together on my website. And if you want to go to drhyman.com/connecting, you can download my Take Back Your Health chapter from my book. It's free. Don't tell my publisher. Now, every day we have hundreds of little choices we make. And it's in those hundreds of little choices that we make a difference. You know, as Mother Teresa said, there are no great acts of love. There are no great acts. There are only small acts done with great love, right? So every day we do 1,000 little small acts. We make 1,000 little choices. Every day you vote 3 times with your fork. If everybody in America decided tomorrow to boycott junk food and fast food, guess what will happen? I want to have an eat-in. You know, I want to create a mass eat-in where everybody agrees to eat in for 1 day a week and has to eat real whole food and can't buy anything in a box, a package, or can from a fast food restaurant. We need to understand that there are 1,000 things we can do. You know, in America, 1 in 5 breakfasts is a McDonald's breakfast. The food industry has hijacked our homes. They've hijacked our kitchens. You know, Americans eat home about 3 meals a week, maybe, for 20 minutes, where each member of the family eats a different packaged food, microwaved, that's made in a different factory while they're texting and watching TV. It's the disintegration of our family dinners and our homes that's driving obesity, that's driving mood disorders, that's driving poor school performance. This is all documented, validated data. So I encourage people to take back their kitchens, to learn to cook together. I mean, we're raising a whole generation of Americans that don't even know how to cook. Americans spend more time watching cooking on TV than actually cooking. Media. I sat next to, at this conference last week, the guy who was the head of Ogilvy, which was responsible for marketing all these sugary cereals to kids. And I felt like I was sitting next to, Stalin, who had caused genocide in all his children. And we serve up over 10,000 ads every year to kids in America, spend over $13 billion marketing junk food. We're the only civilized country that allows this anymore. I think we allow this and the death penalty. We need to ban food marketing. We need to take back the media and not allow this to go on. There's some people here who've done a great movie called Two Angry Moms about how we need to take back our lunchrooms in school. I mean, most schools in America only have a deep fryer and a microwave. How can you serve real food? How can kids think and learn when they have soda and chips for breakfast? Right? They can't. And this has been well documented by many researchers. We need to take back our places of worship, right? Most churches are places where you eat sugary processed, high-fat foods where you get to heaven early. Not a good thing. We need to take back our workplaces where we can have different defaults, where we're not just eating cookies and donuts and cake, and we're not scarfing down sodas all day. We need to make safe workplaces. And there are places I know where people, for example, are creating potlucks, lunch potlucks, where each person will make lunch every 2 weeks and bring it in, and we'll serve lunch together and be together. And we need to take back our democracy. We need to change our policies. We need to have lobby reform. We need to change agricultural policies. We need to change marketing policies. There's a whole series of things that I outline we can do. And we need to take back our healthcare system, because doctors don't know anything about nutrition, which is driving the main source of the diseases they see today, and we need to stop the madness. So we need to take back our health. I encourage you to join me in this movement, to do the things we can do together, to start getting healthy together, because we can't do it alone. And as the African proverb says, if you want to travel swiftly, go alone. If you want to travel far, travel together. Thank you very much. Thank you.